I guess I'll just introduce myself. So I'm Dr. Thor. Thor is my first name, but I had a chiropractor tell me as I was going through school that if I didn't go by Dr. Thor, I was dumb. So I just go by Dr. Thor as opposed to my last name. So I graduated from University of Western States in Portland, Oregon about 5 years ago. So 4.5. It was 2020, right in the midst of the pandemic. So it was a fun, at least I got all my classes done before everything shut down. So don't worry about that. I didn't do digital chiropractic for half of my degree like some people did. But yeah, so I ended up, I worked for 8 months in Utah with a buddy, and we worked together at his cousin's clinic. We ended up, it was too small to support all three of us, and I was the last one hired on, first one to let go when things were getting really slow, and I ended up coming up here. I grew up in Seattle and always wanted to come to Coeur d'Alene area because I did undergrad in Idaho, eastern Idaho, and my wife and I always kind of wanted to move back to Idaho. So once Coeur d'Alene, there was an opportunity, we just jumped at it, and so we worked at another local clinic probably for about 1.5 years, and then one of the former employees of that clinic was working for Dr. Toby and set us up with an introduction and said that there was an opening, and that was about 2.5 years ago. Coming up on 3 actually in March. So it's been awesome. I love working here. We have an amazing team. And so as a chiropractor, most of what I deal with are what we call musculoskeletal conditions. So anything to do with muscles, spine, joints, ligaments, tendons, and I tend to focus more on spinal issues. Nothing super crazy, because I'm going to send that to a neurosurgeon or neurologist or an orthopedic surgeon, but for most of your aches and pains, or for coming out of a serious injury like a disc injury or something like that, chiropractic has actually been proven to help people recover faster and just go through life without needing as many pain meds or anything like that. But one thing always really bugged me when I would have patients come in and say, "Hey doc, my shoulders kill me," just like Jim was telling us earlier. And I would kind of say, okay, well here's what I can do. We can do some soft tissue work on the muscles, which I would prefer to send them probably more to a massage therapist. They're better at that than I am. They have more time to do that. Or we can adjust, but adjusting the shoulder, there's really only a couple adjustments. And if it's just tendinitis, if it's a muscle tear, if it's just inflammation, that adjusting might not be the best thing for it. Most likely isn't. So adjusting, all that does is just set the joint deeper into the socket and allow for better movement. So after a couple of those cases coming through my office, I started getting a little frustrated, kind of just saying, well, I mean, here's your options, here's what I can do for you, but I don't even recommend those things. You know, go to a physical therapist, that's what I would try, or just rest, ice and rest, and hopefully it'll start to come down with inflammation and pain, you'll be able to get more range of motion, then we can do a little bit more. But that's kind of what was happening, and I was getting a little frustrated. So that same friend that I worked with in Utah, I was talking to him, and I was kind of expressing that frustration and started looking into shockwave machines. I heard of shockwave therapy and was kind of interested into it. I did a little research on my own, and so I asked him, I was like, hey, what do you know of shockwave? And he said, oh dude, I have one of the best shockwave machines that he's used in his clinic that he was working at, and he's still working there. And so that was this Softwave machine. So we started talking, he started telling me more about it, and I actually went down there and was visiting some friends and family in Utah, so I swung by his clinic. I shadowed him for a day, we talked about it, and then as I was looking more into it, I decided, you know what, this is something that is kind of missing in my practice, missing here in the clinic, and something that can help a lot of people. So what is Shockwave, okay? So first off, what is Softwave? So Softwave TRT is the brand And what it is a shockwave therapy device. So TRT stands for Tissue Regeneration Technology. And what it does is it uses electricity and water to deliver a shockwave, or almost a ripple effect in the body. What this does, it's non-invasive, and it stimulates your body's healing abilities to be able to increase blood flow and decrease inflammation and allow your body to do basically what it's supposed to do, but at a maximum and accelerated level. So let's see if this little video here works. Nice. So this is kind of just an animation of what's going on, what's being projected by the machine, and that will go into our body here. Okay, so shockwave, we were kind of talking before it started, but the technology is not new, but it started out as lithotripsy, which was developed to pulverize kidney stones and gallstones. So it was developed, in the 1980s. And in 1985 in Munich, Germany, it was the first clinical treatment of a gallbladder stone. And what they do is they had a guy sit in the bathtub, and then they use the water in the bathtub and the machine to direct a sound wave and focus it onto where the gallstones were. And that sound wave, as it was focused, it would get smaller and smaller and smaller. And when it hit that target stone, that stone couldn't handle that amount of pressure in that small area and would start to break up. So they used these and were developing them so they didn't have to use surgery to remove those larger stones that were unable to be passed. Then as the technology started to develop, they thought, hey, let's, for some reason they decided to investigate fractures and start doing it on fractures and see what happened. Maybe the vibration would help. And they found that the shock waves going through fresh fractures actually stimulated all of the bone cells to start clearing up dead bone tissue and laying down new bone tissue. And then further on down in the 90s, they actually started using it on musculoskeletal conditions and soft tissues such as muscles and tendons and all that. Another cool thing is they found a success rate of improving the healing rate in the non-union fractures in 1988. And they found that 60-90% of the cases in a study improved and accelerated that healing rate. And then the first treatments for shockwave on other conditions kind of were targeting feet and other tendon type issues. Tendons are one of those things, they have very little blood supply, so when you have a chronic injury, it just takes forever to heal, if it even fully heals at all. Sometimes it just kind of calms down but doesn't heal because of the poor blood supply. So they found that it was actually quite effective as a treatment for that too. And they decided to ditch the bathtub, so they started making handheld devices in the late 80s and 90s, and now we have a bunch of different devices today. So you can kind of classify shockwave devices into two categories. So the first category is called a radial, and that's what you'll see up at the top. Oftentimes radial shockwaves have a long cylinder applicator, and inside is kind of a tube with a metal projectile. So it uses air pressure to throw that projectile 80 to 90 miles an hour, hits the head on the inside, which then that force is transferred through the tissues as a shockwave. So the radials, what they do is the shockwaves will disperse and start to decrease in energy density out from the head. So they kind of radiate outwards. So they're really good for close to the surface type issues, and they do get a broad treatment area the farther it goes down, but it does start to get weaker and weaker. So they don't go very deep. A lot of times they go up to 4 to 5 centimeters deep, which is not a lot, about 2 inches. So really good for elbows and heels and feet, but not so good for shoulders and hips and stuff like that, or anyone who has more muscle or fat tissue. Now the second type is a focused shockwave. So if you think of the radial, as you can see with the diagram, it's almost inversed. So the waves almost start wide, but then the applicator has a specific way of focusing the shockwave to where they will come together deeper in the tissue. This is similar to what they used with the lithotripsy, so to pulverize the kidney stones. Whereas there they would actually focus it and have a depth that they would measure with ultrasound or x-ray. So they could find the stone and say, okay, we need to put it at this setting so we're not shooting past it or above it, so where the shockwaves are converging right on the stone. But for musculoskeletal conditions, it's really good for just getting quite deeper. A lot of times these ones, they tend to have a laser pointer type feeling to them, as people report, as they're getting the treatment. It comes down to a really small point, and these ones can go 10 to 12 centimeters deep, so about 5 inches or more. So what are the benefits of shockwave? Why would we want to introduce these sound waves, these acoustic pulses into our bodies? Well, first off, it's non-invasive, so there's no drugs, no needles, and what the benefits are is, first off, there's pain relief. The effects and mechanical effects of the shockwaves, similar to massage, they help relax, help move blood around, they can affect the muscle fibers. There's very little to no side effects. The only side effects are maybe some soreness if the energy is quite high. Now, if we were using a lithotripsy machine, then we might not want to do that. But with these ones, the only side effects I've experienced, or patients of mine have experienced, are just some mild soreness 1 to 2 days afterwards, and that's still not very common. A lot of people also use shockwave when kind of surgery and other things, they don't want to put off surgery, or they've already tried other therapies such as corticosteroids, anti-inflammatories, pain meds, physical therapy, all of that. Shockwave is one of those things that they can try to do that without going into surgery. But the biggest thing is shockwave, what it does is it accelerates your body's healing. So here we've got a little video. Hopefully we can, I hope there's sound. There might not be sound.
Softwave therapy. When treating a patient, the provider will begin applying Softwave, looking for any inflamed or painful areas. Once they have identified the inflammation with patient feedback, the clinician will provide shockwaves until the discomfort has been reduced or eliminated. The pain relief is the result of multiple mechanisms of action, including the modulation of inflammation and neovascularity. Because Softwave delivers therapeutic levels of acoustic energy over the broadest treatment area, Softwave therapy will always require the least number of shocks, the fewest treatments, and superior outcomes with the least pain, at energy levels that do not cause cellular trauma or injury. Softwave is the only device that utilizes patented parabolically focused shockwaves to effectively treat pain. This technology generates electrohydraulic parallel acoustic waves that provide the largest and deepest therapeutic treatment zone. Soft waves trigger a biologic response up to 12 centimeters from the spark discharge and initiate healing at a cellular level over the broadest possible area, dramatically reducing pain with the fewest number of patient treatments. How does it work? Softwave's acoustic parallel waves activate cellular receptors, initiating the body's own natural biologic healing response, non-invasively and without drugs or injections for pain. Softwave is the only device that utilizes patented parabolically focused shockwaves to effectively treat pain. This technology generates electrohydraulic parallel acoustic waves that provide the largest diagnostic and therapeutic treatment zone. Softwave technology is validated in hundreds of international publications, holds dozens of patents, and is used by leading national and international research and medical centers, as well as major sports team physicians, from NFL, NBA, MLB, and other national sports organizations.
All right, so that video did touch on a lot of what Shockwave does. So most of those mechanisms are active in all Shockwave devices. So what made me get this one instead of going with a different one? When I was doing my research, when I was experiencing it, these are the things that set the Softwave machine apart from a lot of the other ones. So Softwave is the only one that calls themselves an unfocused beam or an unfocused shockwave. So we talked about the two different types of shockwave, which were radial, which went outwards from the head, they didn't get very deep, or focused, which came together at a farther depth. Well, what Softwave does is their applicator, they call it the unfocused beam. So they're parallel, so you heard it a couple times in their video, the parallel waves, they kind of go out more in a straight line rather than going to a point. And one of the sales rep actually said, he goes, really what it is we call it long focused. So whereas a focus will come together usually within the tissue, the long focus, the target where those waves would actually come together and converge is well beyond the actual tissue distance we're treating. So we're really kind of getting mostly those parallel waves. What that allows me to still achieve the depth of shock waves as a focused will, while treating a larger area at the same time. So that will make less treatment time because we're basically painting with a large paintbrush rather than a little pen. We talked about the laser pointer effect of the focused ones. Well, this is more of a shotgun effect while still getting that same penetration. So we don't have to go over the area as long. If we have a large treatment area, we can cover it a lot quicker. So there's less time, less pulses, and I'm not going to sugarcoat it. If we're going over an injury, the pulses are painful. And so the less pulses to get the same effect, the better, right? It doesn't hurt afterwards, but it's like a good deep tissue massage, and I'm excited for you guys to try it out and at least get a feel for what it feels like. Another thing too is because the energy is spread out, there's less trauma to the tissues. So one of the ways that shockwaves achieve the accelerated healing is through micro trauma. So that shockwave rippling through our tissues is causing a little bit of micro trauma. Not enough to damage, but enough to instigate an inflammatory and healing response. So if those shockwaves were really focused, that micro trauma is going to be a lot more. But if we're able to get enough energy deep enough but spread it out, you just less chance of getting sores. Fancy way of saying that. Another thing too is that applicator doesn't hit the same every time, so it actually varies the power. So if we look at these numbers here on the machine here, this number up top is the energy level. So that's how hard it's pushing. So if we have it going, and you can kind of hear. Now if I were to turn it up, it's hitting a lot harder. You can even feel the recoil even more. So doing this, it actually, even though it has one number, which is more just to tell me how strong to do it or what to do next time, it doesn't hit the same every time. So it goes a little bit deeper, a little bit shallower, and that prevents your body from getting used to it. So as that is going, you will be feeling each hit, and the way we kind of know, oh hey, we've gotten enough shocks in this area, is you will start to notice that each hit is less intense, things will start to relax. Sometimes it feels like it lets go. We want to make sure that's just not your body getting habituated to that stimulus. So it varies it enough to where your body's always guessing. So when you do feel that, you know that it's actually the treatment working, rather than you just, okay, well, that's happening, we're just going to put it to the back of our mind here. All right, and then another cool thing about this, and the way that the head is designed, it actually allows for a lot more applications. And we'll go over those So we can go over not just musculoskeletal injuries, but there's a lot more applications for this type of device. So what is going on when we say accelerated healing? So what are the effects? So the first off is pain control. Then we have increased energy production of our cells, increase in local blood flow, and then accelerated tissue repair and regeneration. So how does it control pain? So one of the things that it does is it decreases substance P. So what is substance P? Substance P is released. It's a chemical signal released by our bodies when we are injured. What it does is it helps transmit pain signals from the spinal cord to the brain. It also sensitizes our neurons in the local area that's experiencing the inflammation or damage to be more excitable, so that it's easy for those pain neurons, or nociception is pain, the feeling of pain. So if you have a sore shoulder, if you have inflammation, even the slightest pressure is going to be painful, which shouldn't be, but that's because substance P is going through and decreasing the threshold to where those nociceptor neurons are firing. So another thing that it does, substance P enhances vascular permeability and attracts white blood cells to the area, so it does instigate the healing process. But they've also found in chronic pain conditions, the area does usually have elevated substance P, and so if we can decrease that, we can move on to the next step of healing. We can get regeneration, repair, and all that going. Another thing that it does, so to increase energy production, as the shock waves go through, what they found is the tissues experiencing the shock waves have increased lactate concentrations, which, if you remember from high school biology, the Krebs cycle and glycolysis, which is used to create ATP. ATP is what our cells use to do anything they want. So if I go like this with my muscles, I'm using ATP. I'm using ATP to talk, to think, to breathe, to digest. It's the cell's fuel source. So lactate is one of the byproducts created by glycolysis, and can be used to then go into the Krebs cycle. There's a lot of different things there. That's a whole different lecture for that. So, but it does increase ATP production. Another thing is our cells all have a set turnover rate. There are some cells that never die, but most cells do turn over time, some sooner, and some. What this does is it just lengthens their life, so there's less cell turnover, so they're able to just work longer, harder, while we're trying to heal that area. One of the main effects too is increasing the local blood flow. So an immediate effect is nitric oxide release. So when we do shockwave over an area, what that does is the nitric oxide opens up those blood vessels, relaxes the muscles inside them, causes them to relax and open, and then increasing the blood flow, which is not only key for nutrients, but also helps regulate swelling. There's been pretty cool times where I've had people come in just with a swollen knee. They don't know what happened, and we're able to just give them a treatment, and it went down significantly, and they were able to get more range of motion just with one treatment. Last week I had the privilege of attending a webinar, and it was put on by Softwave, and their speaker was the head physical therapist for the UFC. So I don't know if the UFC is the MMA fighting promotion, and they probably one of the larger ones. They have a lot of athletes, and down in Las Vegas they actually have a performance institute, and anyone who's a member of the UFC, you can go, because they're all independent contractors. They live all over the world, but if you're a member of the UFC, you can go there. You can train, use their equipment, use their doctors, use their therapy services. And so she has a lot of athletes coming in and out, and they're fighters. So trauma, repetitive injuries, training injuries. They also have, they're cutting weight, so there's maybe some issues with maybe bad nutrition at the end, or as they're dehydrating themselves to make the weight, their tissues get weaker. So there's quite a bit risk for injury, let alone just the fight itself. And she has noticed a significant tool in the Softwave in just helping reduce inflammation and swelling. She's like, she said she uses about 90 to 95% of everyone who comes in and sees them. She's like, I don't care what it is. Usually we'll either start or end with the Softwave treatment because it just helps them that much more. So, now we have that nitric oxide was a temporary increase. So that's pretty immediate. You'll feel that when you do get a treatment. But one of the claims to fame and why they call it tissue regeneration technology is a permanent increase in blood flow. So the mechanism, when I was looking at it, trying to figure out why, they still don't know really why. There's a couple theories, but they found that there is actually new growth of blood vessels accelerated by the shock waves in the area that's being treated. So down here, they found even a 300% increase within small, medium, and large blood vessels within 12 weeks of the first treatment. Some people have found that there's some factors, I think it's this one right here, the TLR3 signaling, which we'll talk about here in a bit, for some reason is both immunoprotective but also angiogenic. So it can help repair blood vessels, but also just grow new ones to that area, which is why it's so effective for issues in the tendons and in ligaments that don't have a lot of blood supply. We're able to actually see more healing than probably we would without the shockwave treatments. And blood flow is good. If you have blood flow, all the tissues get what it needs. They get red blood cells, they get oxygen, they get nutrients and all that. So, all right. And then tissue repair and regeneration. So we kind of touched on this in the history. They were looking at non-union fractures. So they found an increase in osteo cell activity. So osteoclasts are bone breakers, basically. They break down old and damaged bone. And osteoblasts, what they do is they will lay down new bone. So both osteoclast and osteoblast activity was significantly elevated when they were exposed to shockwave, as well as fibroblasts, which is more for fibrous tissues, collagen, tendons, ligaments, that sort of thing. And the cool thing about the osteoclast, which is breaking down the bone, they've actually found quite a bit effectiveness with people who have calcific tendinitis, which is where calcium deposits start to grow in the tendons. Usually it's found in the shoulders, but it can be found in other places. But this shockwaves help the osteoclasts to dissolve the calcium in the tendons and help that not be an issue as much. So. Another cool thing, and we're hearing it a lot, and it's getting more and more popular, stem cells. So stem cells, they are kind of a whatever you need me to be type cell. They can multiply and divide indefinitely and can turn into various types. When we're born, we start out as basically just a clump of stem cells. But this one, it actually causes migration and differentiation of mesenchymal stem cells. So mesenchymal stem cells are adult stem cells. They're found in our bone marrow, in our fat, and also our teeth, in the dental pulp. But what they do is they can divide and become different types of connective tissues. So bone, fat, cartilage, and muscle. So all of these things that we're trying to heal, a stem cell can say, hey, what do you need me to be, boss? And they can become that thing and really help regrow or repair. And so they found that after about 4 weeks from the first treatment, they found stem cells have been migrated to the area that's been being exposed to the shock waves. And then another thing that they found is the TLR3 signaling, which we talked about, helps with the angiogenesis. They also found it helps protect neurons and also regenerate neurons. So there are, and this is still very new with shock waves and it's still being studied, but there are cases where people are treating neuropathies and helping actually regrow the nerves as well as provide a blood supply for them. Now how much they're regrowing, I don't know. It's still pretty new. There was a guy that the guy that I bought this from, he at first worked for the company selling them with him and some partners, and they ended up thinking it was so amazing, they started up their own clinic in Salt Lake, Utah, hired some doctors on to prescribe the treatments, and so he both sells and does the therapies. And he said they did have a guy come in with spinal cord damage from a car accident and was able to greatly improve motor function. He said it took a lot longer than normal musculoskeletal treatment protocols, but there has been signs of nerve regrowth. So that's cool. I'm still learning about that one, but that's something that's pretty awesome if it can do that. Now, we also talked about the Softwave itself and how it can be applied, and there's actually a couple different things, not only musculoskeletal, but it is found to be effective with erectile dysfunction, improving the blood supply. They found endometriosis patients get quite a bit of relief with shockwave therapy, pelvic inflammatory disease, also pelvic floor therapy has been found to be effective and helpful with shockwaves. And cool thing is wound care, so something that I'm not doing, but maybe I will delve into the future, but diabetic ulcers or slow to heal wounds, especially those with diabetes or peripheral neuropathy, and decreased blood supply in their feet. This has shown to help increase the healing process significantly. So I thought that was really cool. Another thing it does is remodeling. So we talked about regeneration, but there's also remodeling going on. So scar tissue, when scar tissue is exposed to the shock waves, the scar tissue can actually start to remodel, restructure, and that activity is increased. So doing it over scars is something that both my friend has seen quite a bit of success with down in Utah in his clinic. But also when I was listening to the UFC presentation, she said that they would do it over all of their surgical patients. They would do it once the bandage was able to be taken off, they would be shocking it. And so they would see a significant reduction both in the swelling, so that it would allow them to do better with physical therapy because they have more range of motion, less pain, but also scar, just smoothing out the scars and improving the scars. She also had a really cool story of one of the executives for UFC. So she wasn't an athlete, but she was an executive who had terrible back pain, and it was mid-back pain. And she's like, I've done MRIs show nothing, x-rays show nothing, specialists are like, you're fine. Like, we can't find anything wrong, we're not denying the pain. And so she came in and was just coming through their Performance Institute, and so she's like, well, let's just see what's going on. And through the health history, she found she had double mastectomies and also a C-sections. And so she started looking at the scars from those, and the scars were really, really tight. And so she was like, when you looked at her from the back, she looked normal. From the front, she almost looked twisted, just the way the skin and the scars were going. And so she started doing shockwave treatments on the scars. She's like, well, let's just try this out. Let's see if this works. And what it did is it softened up that scar tissue, and almost like it was a harness just released, and then her back pain decreased significantly, almost went away. So that was really cool, and just another use that we can do with this. And there's also a whole use case scenario for skin rejuvenation. So there's been improvement in cellulite. There's been improvement with stretch marks, and also just skin healing. So I don't do that. I would probably look into more protocols for that, but the machine can do it. It's pretty cool. If you think about it, more blood, faster healing, it's going to help your skin. So there's that too. All right, well that's the presentation. So I guess what we'll now do is just open it up for. That didn't turn on. Okay, there we go. Just any questions? Yes.
So how does it do if you go over metal?
I was gonna ask the same question.
Yeah. So over metal, in my experience, metal vibrates and can conduct vibrations. And what we're dealing with is one giant vibration. So going over metal, it's not going to hurt anything. It might hurt though, if that makes any sense. So when I've been going over patients who have metal screws, I had a guy who had shoulder surgery in the late spring, around June, early June. And then he tried to go back to work. He's an electrician, and he's like, I got back to work too soon. It's starting to get painful. It's still kind of a fresher surgery, but he's all done with PT. So he came in, he did the shockwaves and was helping. But every time I'd go over to where one of the screws were, he'd go, whoa, okay, I felt that. So, but it never made any lasting soreness or any damage or anything like that. So it's safe, but is it comfortable? I think that's more individual, but we're not going to be hovering over all the metal.
So I've been having an issue with, it's like an insertion point, Achilles issue.
Yeah.
So I'm doing a lot of just like, some physical therapy stuff, like holds with a barbell and walking on my toes, that type of stuff to repair it.
Yeah.
And I'm assuming this would be I saw the pamphlet, it looked like it would be kind of right up the alley.
Yeah.
Something like this.
Perfect.
Right?
If you were to go and look up, actually I have it on my notes. So like the first musculoskeletal disorders that they were investigating with just shockwave therapy in general. Was for the elbow tendonitis and heel spurs. So heel spurs are where the Achilles tendon hooks in and it's pulling so much that the bone starts to build up.
Right.
So whether that's what's going on with you or similar, a lot of the research that has come out is on plantar fasciitis and Hageland's deformity, which are those bone spurs.
Okay.
And it's showing amazing results. I actually have a patient who is experiencing, she's already experienced a lot of relief initially, and then what we're doing is she bought a package of treatments and she used them up to where she's not feeling pain anymore, and she's holding on to the next ones until she starts getting more active once the weather starts getting warmer.
Sure.
She's a big avid frisbee golfer, so she's like, once I start frisbee golfing, we're gonna, hopefully this will help as well, because it's one of those things where for her, I told her, I was like, we're not gonna be able to shave down or knock down those heel spurs,
Right.
but we can calm that inflammation and heal those tissues. So it's not as much of a problem, but she might have to come back every once in a while to do the treatment. Yeah. So, do you want to try it?
I do want to try.
Yeah.
It. Absolutely. Question though, so if I do this tonight, I saw something about I don't go on a long walk after. I usually walk early in the mornings for 2 to 3 miles. Is that?
You should be fine. So we won't have time to do like a full treatment,
Okay.
but I just want you to experience it.
Sure.
The biggest thing with this is because we are starting the healing process through microtrauma, we just want to make sure we're not impeding that. So on your pamphlet or the paper that I gave you guys is just what I give every patient after the next after their first treatment.
Okay.
So here's what to avoid, here's what not to do. And really don't push it. So if you've been going on long walks, you can continue to do that.
Okay.
But what I don't want to have happen is if you feel amazing, so then you decide to go on a long run. It's like, well,
Yeah, that's not.
so, but yeah, if there's no other questions, we can try it out.
I have a question.
Yeah.
Because I started, it's been, I don't know how many months now, but my hands started not wanting to close. It started with one hand
Okay.
And then it started, oh,
Like that.
yeah, okay,
That's me too.
oh.
Yeah, the quivers and their damage, everything.
So I don't have quivers yet, but I work, okay, I don't know, but, and I forced my hands to close, so
Yeah.
I was waking up and I couldn't close, it started with this hand, and I couldn't close it, and so I just kept forcing it, forcing it, forcing it.
Do
Right
they feel
now,
like they're swollen?
it's,
Yeah.
and they are, and the knuckles gotten bigger, I had to take my wedding rings off,
Okay.
cause then it moved into this hand. Now I can feel it up in my elbow, I can feel where it kind of goes up the arm, and my arm it'll feel like I've had a workout, and I've not
Mhm.
worked out that
Okay.
day or the day before.
Have you gotten an official diagnosis of anything?
No,
Okay.
no, but if it is arthritis, would that work for something like arthritis?
Yeah,
In
definitely.
hands?
Yep. So what it can do is it can slow down the progression. It depends on what type of arthritis. If we're talking autoimmune, like rheumatoid arthritis,
Mhm.
that'd be something you definitely would want to continue on investigating maybe with a rheumatologist.
Okay.
But
Because I
this,
have an autoimmune already, which,
Okay.
which always leads to possible another autoimmune.
yeah,
But then I have one other thing, I have when I was 13, I was pulling up a fence post, and I have a rib that went out,
Mhm.
and it's gone out for the rest of my life. Every once in a while, when I just do a weird movement, it didn't actually go out the normal way it goes out, but I just started back to being normal, like was out for like 6 weeks. Not sure what happened. I do taekwondo, we play pickleball. Not sure what happened, but it was a different feeling. Normally when it goes out, I can't breathe, and but this one was just super painful, and so, but I feel there's like a little bit of a knot in there, and I'm not expecting it to never go out again, because it's just something that I deal with.
Yeah.
And I've dealt with.
but from this
So,
episode, you're
yeah.
wondering this would probably take that knot away. Cool thing that one of my I would say my biggest successes with this, and we had a patient come in and she was dealing with knots on her shoulder blades, where everyone gets knots. I mean, as a chiropractor, I can put my hand on somebody and 95% of the time,
You feel it.
I'm in the same spot. It's like, hey, I'm pretty sure this is going to be tight, and it's tight on 95% of the people.
Yeah.
But for her, she had already been getting regular chiropractic care. She had been getting frequent massages, 2 or more a month. So that's pretty frequent for most people who think like once a month is pretty regular. I get one maybe once every 6 months or once a year, but she's just like, it helps it, but it's never gone away, and it was making her hands numb. It was kind of almost like referred trigger point pain. So we tried it out, and she was like, that was the first time like I literally didn't feel the knot afterwards.
Oh.
And she was like, it felt great for a week. And so I think we did 4 sessions, and she was able to, she's like, hey, we're good. We actually used up some of her treatments that she bought for a different area because they were doing so well in the shoulder blades. So even though, because of the cost of the treatments, I usually don't say, oh, if you got a knot, yeah, let's do it.
Yeah.
But if it's not that's just been around for a long time and doesn't calm down in other ways,
Yeah.
I said this is one of the best ways. It's almost like a massage, a deep tissue massage that can go past even the heaviest elbows, and it's not going to leave you bruised afterwards.
Okay.
So, yeah. But
Okay.
let's try you.
Yeah, let's try it.
You can try it. Anyone else to try it, we'll let you go. And
Okay if I record?
Yeah. And honestly, the annoying thing about my tendon deal is that it's not like one of those things that just hurts all the time. It's just when I put my leg up front and I start to pull my toe up, it feels just
like it's
Mine's
super
from
tight.
stingy,
my
almost
neck
pull
bone
type of thing.
Okay.
It's kind of a little better. I mean, it's really easy on it.
My vertebrae's
Exercises,
spinal
and walk
cord.
just fine.
And
But
we did do it about
I don't get scared to try anything past
Well,
that.
right, so you want
It's
it to
like-
flare up.
Yeah, exactly.
With my
So-
right side.
Okay, so let's take your shoe and your sock off.
Okay.
Yeah.
And what I'll have you do is I'll just have you lay face down, but I'm gonna just go over kind of a protocol here, okay? So I can't feel what you feel, right?
Yeah.
So what I'm gonna need you to do is tell me when I hit a spot that just lights it up,
Yeah.
alright?
No, I was
So
seeing that.
what we'll do is we'll put some ultrasound gel on it, okay? And then as you kind of saw in the videos,
Well, they
we just slowly move it around as it clicks. Okay. When we hit a spot of inflammation or where the worst injury is, it's gonna be like someone dinged you with a hammer right on that
That's the
spot.
same
Really?
thing
Okay.
along with
So
pain.
let me know when that happens.
All right.
We don't want it too much,
Okay.
but we want it to be strong enough to where it's actually doing something.
Right.
So
Okay.
to me, that's anywhere between a 4 and a 7 out of 10.
Okay.
So a 7 means, to me, you can remain calm, but it's strong enough that you're probably gritting your teeth, maybe your breathing gets elevated, but you're not having to tense up. Okay?
Okay, judge between that and tattoo removal.
See, I've never had
I've never
to do
had
that.
one take
I've heard
out
that's
either.
real
I
pain.
can bad
So
it.
a lot of
That's
people
real
say
bad.
that this feels different than tattoo, but tattoo is both worse.
Yeah, it's.
But this can get sharper each hit.
I
Like
got a buddy,
tattoo's
it's,
constant.
it's got exotic animals, lions, elephants and stuff, and they use that on them.
Really?
Yeah,
That's cool.
yeah, when I seen that, I went, oh, is it the same thing?
Okay, so go ahead and we'll lay face down.
And it's down
Right through there?
here, kind of more like insertion point, kind of
Okay.
like here and down.
Perfect.
We just want to catch your face.
Right? Yeah. Just turn the other way.
The expression
We
on
have
your face is
tissues.
what we're really looking for
Oh, yeah.
first. Oh,
So-
come on, man, turn over. Put that camera under there.
The cool thing about this for me as a practitioner is, so what was your name?
Tanner.
Tanner. So Tanner told me where he feels the pain. I'm going to listen to you, but I'm also going to go and explore all of the areas because where you feel the pain may not be where this
Yeah.
generates the pain.
Okay.
So it could be referred pain, and when doing heels, a lot of times people are like, "Oh, it hurts right here," and
Yeah.
we do the entire bottom of the heel, and they're like, "That's nothing." And then I start to migrate up here, and they're like, "Oh my gosh, that just lit it up." So that's the cool thing is this kind of tells me where the problem is, and I don't have to do anything as long as I have a good knowledge of anatomy. You're right. I can kind of guess. Well, if you're hurting here, maybe we should investigate these also. Different areas. So I'm gonna have you point your toes just like that.
Okay.
Perfect.
Okay, smile.
All
Ah, come on.
right, so I got it kind of low. Okay, so you're not gonna get blown off the table here. And we're just gonna start slowly moving it around. But are you feeling the pulses?
I feel a pulse, but it feels more like someone just kind of tapping on
Just
my
kind
leg.
of flicking you. Yeah. Good. So we'll go over to where most of the inflammation most likely is. And the heels are always hard, so I'm trying to hold it.
I feel that slightly, yeah, I feel like a little more of
It
a
gets a little more intense,
little
okay?
sting,
How about right there?
less.
Nothing there. How about on the side? Not so
A little
much.
bit, It kind of started to hit something, yeah.
Okay, then on the side, same or nothing?
Not as bad,
Okay.
kind of in the middle.
All right, so we know where to go now. So I'm gonna bump it up 2, and then we'll go from there. All right?
No,
Nothing yet.
a little bit in there, yeah.
Okay, so what level are we at? Give me a number out of 10.
4 or 5.
4 or 5?
Yeah, 4
Okay.
or 5.
So we're right in that.
Yeah.
We're right in that range. So now I'm just gonna hold it there. I'm just gonna let it do its work. This is the easy part for me too. Now what you need to tell me is you need to tell me once it starts letting go and decreasing, and that will know, hey, that's gotten enough shocks in that area to where we can move on.
Feels like it's starting to decrease.
There you go. Tell me when it gets to a 2. About right there?
About there, I think.
Perfect.
Yeah.
Okay.
There.
Now we're gonna bump it up one more.
Okay.
We're gonna make sure we're not missing because every time we go up, it's getting a little deeper, right?
Right.
So we know where this one is, but there might be deeper ones up here that we just weren't hitting yet. So we're gonna do everything all over again.
Ooh, right there.
Right there. What level are you hitting here?
About 5.
Okay. So we'll just let it do some work here. Then we'll go back to that first spot and we'll hit that one more time. So he just jumped. That's the variability of the machine. And you can kind of tell. Sometimes it even, you feel it, you say, oh, that's about a 5. And then as the surface tissues relax, it gets deeper, and it's, oh, that's a 6 now. But then eventually it will start to decrease. How about now? We had a 4 or a 3?
Still probably a 4-ish, yeah.
Okay, so went from a 5 to a 4. That's probably good enough.
Okay.
And then we'll head over to, how about here?
Yeah.
Maybe a 6, 7?
Yeah.
I see your butt twitching, so.
This end is too.
Alright, so let me know when this gets down to maybe a 5 or 4. Okay? Just breathe through it. So I have
Easing up a little bit.
Easing up? Good.
A little bit.
Okay,
Still
we'll keep
pretty-
working a little bit. I have a Facebook ad going out to people's feeds, and one of the guys, someone commented on it saying, what's a blinking light gonna do to help? Does it feel like a blinking light to you?
No.
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 So I just wanted to message that guy. Yo,
Yeah.
Dude, you come in for a free one, I'll teach you a blinking light. Alright, let me wipe you off here.
Alright. Thank you. Yeah,
So-
it's weird though. It's not like I don't know. I really don't like needles, but it's not really like that type of pain.
No,
it's just
it's-
kind of
it's
like
different.
a little more of like someone just knocked you a little too hard or something.
Yeah.
It's interesting.
So for a normal session, how long would you work on like his specifically?
So for a normal session, we do anywhere from 1,200 to 1,500 shocks is what I aim for. 1,200 is kind of the standard protocol. So for your condition and for most conditions that are chronic, we like to start with about 6. That gives us, as we space them a week apart, that gives us 6 weeks of that elevated healing in the body. Some people don't need as many, and they can save them. Some people, if it's an acute issue, I say, hey, let's just go as much as we need and go from there.
How long is the session?
How long is the session? So that was 600. We do around 12 to 1,500
Oh, okay.
shocks. So one session is about 15, 20 minutes. And that's getting them all situated, checking what levels I did last time, that kind of thing. A first visit for somebody, oh, I missed it. I usually have a backboard in my office, but there, so.
So it says not to use ice, correct? So you
Yeah.
should not go home and ice this evening.
Right, so anything
Okay.
that's gonna counteract that micro trauma that we are instigating, so anti-inflammatories, ice just slows everything down. So it's not gonna kill it, it's not gonna render it ineffective, but we wanna give it the best chance we can, so. But how does it feel?
It feels good. It feels like it's maybe loosened up. Just
Loosened
a little
up?
bit. Yeah.
Usually it feels warmer, like you just had a
I-
really
yeah,
good
yeah,
massage.
It does feel a little warmer
That's the
too.
blood flow opening up, the decrease
Okay.
in that substance P. But like we said, the real effects are come from the prolonged.
It's hard to explain too because I didn't feel it like right on the surface. I did feel it. Almost felt like it was in the bone or something.
Mhm.
It was interesting.
Yeah.
A little different feeling.
Yeah, it's very interesting. Okay,
Can I try my back?
sure, yeah. We just need access to the skin.
Probably, yeah.
So
So,
We get a gallon?
we can get it down, yeah.
You gonna try your metal?
I can.
Here, I'll go run and grab. Does anyone else
I can just pull
want
out.
like you want to pull it
Yeah,
up?
I can just
Okay,
pull it
yeah.
out.
Yeah, we'll be fine. So what I'll have you do is I'll have you sit here and face that way,
Are you okay if I record?
and then I'm just gonna scoot this back so you have a little room. All right, so
Yeah.
where are you feeling it mostly?
So,
Mom, are you okay with him recording? Or
huh?
Are you okay with
Recording.
me recording
Yeah, I
this?
think that's fine.
Okay,
That's fine. It's right in this
kind of the
an
bottom of
area.
that shoulder
Probably if
blade.
you put your thing, yeah, so when you went across
Mhm.
this kind of area,
Okay,
is where I feel it
okay,
mostly.
all right.
Is it a back or a rib?
Well, I don't know, probably the rib.
We'll find out, right?
It's in the same area that my, rib normally,
Alright,
I
so
got a
we'll just
rib
lift up
there.
like this.
Offset all the time.
And then you could just hold like that, we should be good right there.
okay.
Alright, so we'll go turn it back down. gonna be cold, I'm sorry.
Okay.
I promise it's room temperature,
Okay.
but. Okay, so we'll start
And it's
on
more
this.
on the left.
More on the left,
Is it
okay.
getting better?
Excuse me, right.
Longer, yes.
Right.
The right.
Standing around?
The other left.
Alright, so I'm gonna slowly push it in so you get full contact.
Yeah.
Wake up
And
tomorrow.
then we'll
Yeah.
start
It's not
out
like
the.
a chronic pain, it's just too much.
I had it down really low,
Okay.
Yeah.
so if you're not feeling anything after a couple passes, we'll bump that up again.
That's
Sometimes,
kind of what you said, it feels like it's somebody kind of tapping.
yep, it's like tapping right on your bones.
Mm-hmm.
A little metal hammer going inside. But nothing lightened it up.
No,
Okay, so let's go up.
I don't know if I should say that.
We can always turn it back down. And if it's too much, you just let me know. Okay, slowly. The back is one that, oh, right there?
No, I was saying because it's kind of a, yeah, right in that area and to the right
Okay.
of that.
When I get my back done, I end
Yeah, I
up
kind of felt that.
searching around, and so you feel free to guide me.
Okay, a little
'Cause
down.
you can almost kind of feel where it's getting close.
Feel it right in there.
Okay, let's go up one.
Mm.
What number are you at?
So we were at 7.
No, her
Yeah.
pain.
Oh, for pain?
Down a little bit. And then over and back up, kind of. Feeling it just a moment ago.
The back one is tricky.
Right there,
Right there?
a little down a little bit. You kind of rolled over it right in there. Yeah.
What number would you give me out of 10?
Oh, I was gonna say 4 and then it jumped to a 5.
Alright. Well, let's let it do some work and we'll just let it relax. I found the back one is really tricky to kind of pinpoint where it is. How's it feeling now?
I think
Has it decreased or increased?
it's decreased a little bit.
Good.
So a little bit down. Kind of airy and
Yeah. A lot of times on the first visit, I will go way over that 1200 target because we're just trying to find out first off where the spots are and then also what levels.
it's about a 4.
Okay. So let's do this. Now that we've got quite a bit, we're going to go up one more, okay? Doing okay?
Uh-huh.
What was your name?
Natalie.
Natalie. Okay, we'll just hit right here. How does that feel?
Like you went up one.
So we may be hitting around a
So you're
5,
hitting
6.
the sore right in about there.
So
Oh, wow.
let me get comfortable here because we're going to be here
Yeah.
for a second. And then you just let me know what level are we at. Maybe
Oh. Laugh. How dare you laugh? Oh, wow. So it jumps up every once in a while.
uh-huh. And that's that. It hits hard every once in a while. People can probably hear it.
Yeah.
Oh, it knocks the wind out of you.
A little bit. Especially we're hitting your lungs, so the shock waves are passing through. And starting to decrease a little bit. Or is this one holding strong?
It's decreasing a little bit.
Good. Alright, well let's give it 100 more over shocks here.
You go down just a hair, if it's right there. Kind of radiates all on the inside.
And you'll find as we go over areas that have nerves close to the surface, sometimes when we're hitting right over that nerve, it'll travel along it. But, okay. Let's call that good for today here. I don't want to get your shirt all messy. But Natalie, how did that feel? How's that feeling now?
It's happy it's gone.
You can relax now.
Yeah, it's interesting.
Go ahead and test it out. Move it around.
I gotta put my bra back on.
All right, who's up next?
I'll give it a whirl.
Yeah, where do you want to try it?
So I've got kind of this chronic from just working at a desk.
Okay.
In my trapezoid. And I've tried to have it worked on and no one ever seems to get anywhere with it, so I just kind of deal with it.
Okay.
It's kind of a stingy little, it's not totally debilitating, it's just nagging.
It's just always there.
Yeah.
Okay. Yeah.
How's your foot?
So,
It does feel warm.
and it kind of radiates up into my neck a little bit.
Would you be okay with taking your shirt off?
Very interesting.
If that's okay with you?
Yeah.
Then I can actually, I'm probably gonna want to go all the way
I've
down
seen
here,
him
so I
do
want to
that at
stretch
UFC.
this out. If that's okay with you? Yeah. Then I'll have you sit
Right there.
and face that way as well.
Unreal.
Are you okay with me continuing recording, or we can-
Sure.
Okay.
Just don't show my legs.
That's the same thing Chris uses on his lions.
And what we can even do is you can just take this arm out and just,
Interesting.
Yeah,
make it
that's
kind
the same thing.
Huh.
But it's
yeah, just do something like
not
this.
like
So it's kind of like right up,
Right there.
yeah, it's like right there, and it's just always there.
Oh, this is gonna get that little knot that goes in there. This is gonna wake him up. That's where Spot grabs you, you know what I mean?
Just relax.
Alrighty.
You set it to level 10?
So the highest level is 16.
Okay.
Oh, really?
Just yesterday, the first time someone told me to keep going, and we went up to 16, and she was like, I think we can go to a little more. It doesn't go anymore. My ears were hurting. It was so loud. All right, we feel it. And what was your name?
Steve.
Steve. Are we feeling anything yet?
No.
Just the tapping?
Yeah, just.
Okay. We're probably gonna have to turn it up. We're gonna go up to.
If you do that frequently, would you need to wear eye protection?
Not eye protection, because I'm not looking into it.
Okay.
But they do say don't do it over your eyes because of the flash.
Right, yeah.
And your eyes are mostly liquid. Probably just wouldn't be good. But I do have earmuffs in my office that I bought after I was doing it on I think she was a 20-year-old woman, and we were just doing it, and she's like, oh, I feel really cold. And I was like, you are sweating. And then,
Yeah, it's
and I was like,
Yeah.
what's going on? She wasn't in pain or anything, but then she was like, when she came to, her mom luckily was like, she was right there, and she was like, she's just a fainter, so don't worry about it. But I was freaking out at first, because we were doing it right here too, so I was like, are we like hitting her lungs so much she's like losing oxygen? But it was the sound, so once I got the earmuffs, she's fine. Alright, so I bumped it up one more, Steve,
Okay.
because we gotta find this
I think
spot.
it's a little lower, actually.
A little lower.
Probably a little bit.
Closer to the shoulder blade.
So that's the spot that you were talking about in Chinese medicine. That's Gao Huang Shu.
Right here?
Yeah, right where you're at, right along the
Right down
shoulder
there.
blade,
Kind of
and up a little bit higher too. But
when you pull your shoulder blade over it, it kind of exposes it a little.
Anything there?
Nothing
Alright, well we're gonna go up to level 9 then. Let's go.
but this one goes to 11.
Yeah.
feels kind of a dull, like little ache.
Adult, almost like a pinch whenever it hits.
Yeah.
Right there?
Little
Or
lower.
where? A little lower? Tell me where it gets the strongest.
Right in there.
Okay, I'm gonna hold it there.
Just a little bit to the right.
Still not finding it?
Like I said, I can feel it in there, but it's not really grabbing me too bad.
Okay, let's move around. Let's keep going. Different spots here.
Yeah, you're starting to get
Right
it.
there?
Mm-hmm.
Okay, how about down here?
A little bit.
Moving away from it. So it really is right there.
Yeah, it kind of radiates around. It feels like when you get a shot, when you hit a nerve, that kind of that
Yeah.
dull, real dull ache. It's kind of what it feels like.
What would you put it number-wise out of 10?
Oh, maybe a 3.
Okay.
Usually the
Watch
spots
what you
like
say,
that.
Steven.
Yeah.
Showing me
right
up.
there, right there.
Spin that
Okay.
roulette wheel.
Much padding we go through.
Let's go back to where we were feeling it.
A little lower, obviously. Feel that a little bit.
Is it possible he's had it for so long that his tolerance for pain has increased
And
again?
that's what was happening with the patient yesterday. Right there?
Mm-hmm. Yeah, that one might feel that one away from the
All the way through, okay. So let's work here. Let me know when this starts to get a little better.
That's really where they get a sting in the front.
And it's weird. Sometimes they'll point to an area and I look around and look, and then we find different areas, or it really is, especially with the back, it's kind of, you have to search around quite a bit, so. How are we doing, Steve?
Good. That's right about a 4.
Okay. Let's go up one more. Or say it's back up to maybe a 5, 6.
Yeah, maybe a 5.
Okay. Let me know when it gets back down to a 4.
Well, it's funny when I inhale, I feel it up in my sternum.
Yeah, well, we're right on your ribs, so thumping through everything. And if we had more time, I'd probably go
There you're hitting it. Yeah, I started really feeling that.
right there.
Mm-hmm.
And sometimes we just have to like loosen up the tissue, and then it starts to being able to penetrate. And then people will feel that pain increase.
So do people feel it less when it's on a really muscly area versus like right on a ligament or bone?
Yeah, bony areas way more sensitive.
Okay.
Nerves way more sensitive. Muscles can take a lot more.
Got it.
Yeah, now I'm really feeling it.
Oh yeah,
Yeah.
Move my arm a little bit.
You just kind of opened it up. Yeah.
Yeah, okay. Really good.
Well, if your back wasn't so heavily muscled,
Yeah, marble.
like Da Vinci's David, right? That
Oh,
kind of
right.
marble. Compliments are free. Getting better?
Mm-hmm.
Good. Well, look at that. We almost did like a whole treatment on you, so.
You had to find
I
it.
had to find it. So
Yeah.
that's what usually the first ones. I've been sometimes gone up to like 2,400 up to 3,000. Just trying to find what level, what area. All right, move that shoulder blade around.
It was really weird how it radiated to the front.
Mm-hmm.
And I was like getting a pinprick.
It was probably because we were on an intercostal nerve that runs in between. They run all the way around. Well, there you go.
Thank you. See how it feels in the morning.
Yeah. Anyone else would like to try it?
Sure.
Shoulder, yeah.
I assume it would help with like bursitis and stuff too.
It's amazing for bursitis. Yeah. Because bursitis is really all about decreasing that inflammation as fast as you can.
Right.
So.
Have you had it done on
Jim, are you okay if I continue?
Oh, I do it on myself, and then on my back I have my wife do it, and I'll just lay there and I'll be like half an inch to the left, a little bit to the up, a little bit down, bump it up one. So.
Did you guys used to have a chiropractor place up here? No? I know there's a husband and wife that has a place up here.
Oh, no, she's not a chiropractor.
I thought she was.
I taught her how to use it, and actually today she came in and was using it on her hips. We went snowshoeing over the weekend, and she had surgery when she was really little, and took out a tumor that was wrapped around her femur and her femoral artery. So she has a giant scar, and that causes a lot of problems. So especially when she's doing a lot of this. So I was like, here, come and do it before, and then afterwards she's like, now my hip is killing me, so. All right.
Oh, like I said, do you charge her? I can't.
Can't even lift. Okay. So let's see how Jim can lift only to about just barely at 90. All right.
Do you
So
have a tear?
let's take this off, or you can just take the arm out if that helps. Whatever's better for your shoulder. So with shoulders, what I like to do is I will hit the shoulder, but I like to go across because a lot of this rotator cuff muscles end up being the problem. But with Jim being so inflamed right now, he couldn't even lift it past 90. We probably will get quite a bit of effect. We're gonna turn
You
it
can
way
see how
down.
sloped he is downward too on the right side.
What is the diet? Is it a torn rotator cuff or is it, do we know?
I don't know. I have really funky sleep patterns. I'm a stomach and right side stomach sleeper, and I oftentimes will put my arm
Put
under
your
my
arm up.
pillow.
Mm.
And I don't know what I did. It's one of those things like, oh, it's happened before in the past and gotten better.
This one's hanging on.
It hangs.
All right. So we'll start right here. You just relax that shoulder. As relaxed as you can be is better. Oh, look how tan you are compared to me. Move that hand. All right. Now let me know, Jim, if we hit a spot that's lighting it up. And I'll just kind of start moving around in a circle. Sometimes I'll say we're mining for gold, and we got to make sure we find it first. Right about there?
Yeah, right yeah.
Okay, so what number are you at?
Between 1 and 10.
Mhm. 4? Let's go, since we only hit that one, we'll start at 7, okay? Okay, so guide me back onto it here.
Right there.
So does the light actually do anything or is it, no?
Nope, the light is just the electricity, but what's actually going on is the electricity forces the water outward. Woo, you alright?
Found it.
So think more like a firecracker going off, but the electricity allows us to control it.
Is that nerves you're hitting?
And it's hitting harder and softer, and so when it busts past, it's especially when you have. All right, let's go down.
We might be the first show.
You're good. The electricity allows me to modulate and control the explosions, basically. Not going deep enough now, or is it still hitting it? now you're not even feeling it right now, yeah? There we go, now we found the spot.
I think you found it. So
this
that's
was-
the variation, right?
Oh,
And also, the tight tissue is starting to loosen up, so now, and that's more my theory, is it's now able to get deeper because it's softer on top.
Just remember, you volunteered to be there.
Yeah.
Okay, let's move on, we'll give that spot a break. How about down here? Nothing there? Anything down here? Good, okay, so let's, right in that spot, yeah. I wanna make sure we're hitting the rotator cuff muscles as well. Not tripping, ooh, right there.
Yeah.
So this is right where
Oh, yeah.
those rotator cuffs, there's the supraspinatus, infraspinatus, and then their tendons run right through here.
Oh, yeah.
So a lot of times when people have hot shoulders, they'll feel it out here where the impingement is, but a lot of times the problem is back there.
What causes the impingement? Is it a weakness in the rotator cuff, or
That's swelling, the inflammation,
swelling.
yeah.
is it like blocking the bone?
The shoulder is such a complex joint that
Yeah,
when you start getting swollen, it's like, it's really hard to determine what's going on because everything hurts.
yeah.
So,
I get like a pain right on the point in front. I've been doing a lot of like back work and bands and stuff,
Okay.
and that seems to help a lot.
yeah. Yeah, because
Sometimes
right
that
there
point
is
just gets irritated.
a muscle attachment for your pec minor is like right there. And nothing up here. Good. Okay, so let's go over that one spot. So because this is close to bones, this is usually tender on everybody. But
Get that hit so quick though, you don't have time to flinch. You kind of flinch after it hits you.
okay.
It's already done by the time you feel it.
Okay.
Hey,
Slowly
that turned blue, holding his
raise your
breath.
shoulder. Look at
Oh,
that.
look at that.
Oh, my
Wow.
God.
Oh,
No way.
And that's
Are
with
you
that.
kidding me?
That's with the half treatment.
Wow.
Oh, wow.
Wow.
Okay, yeah. That's amazing.
How much did they pay you?
I was gonna say, is he a
How
plan?
much did I pay them? That's the question.
No, I'm not, that's for reals, guys.
That's cool.
I couldn't, I'm just right here. You're a little.
Uh-huh.
That's impressive.
Oh my God.
There you go.
Cool.
I'm sold.
When you sign up for the
Wow.
treatments, is it like twice a week, once a week?
We like to space them out about once a week.
Once a week?
Mhm.
Okay.
So, especially if we're doing chronic stuff,
I did.
yeah, once a week,
Wow.
so we can get, we can double up. If it's an acute one, it wouldn't be as, you'd be fine to do more than once a week. When I was listening to the UFC webinar, she's like, we have people come in every day. But they don't have to pay for it, because it's all
Right.
just, they just come to see it. So it's
Yeah.
like, we use it as much as we can. When they have fractures, they will go, and as long as the fracture's not displaced, because they break their hands quite a bit,
Yeah.
they just, he's like, we do it every day for about a week. And surgeries, they'll do it every day once that wound is able to take the bandage off. And the cool thing, she said, is like, with recovery, especially with surgeries, they're seeing an average about a month sooner that the athlete is able to get back to competition full training, rather than just other conventional modalities and PT and stuff like that.
So that once a week gives you a chance to heal?
Yep, so we're keeping that signal elevated.
Uh-huh.
If we do it too soon, it's like, well, we're keeping it elevated. If we do it too far, it starts to drop down. So the protocols that were developed and the ones that I used, they found that a week is sufficient, but it's not
This should
like
be
a,
interesting here.
you don't do it this way.
Hand.
All right, so let's have you, I'll have you, if you can, straddle the table there.
Are you okay if I continue recording?
All right. Okay, so let's see the hand here.
This is gonna be painful, huh?
I mean, that's
It's all nerve. It's
Okay.
all nerve. It's
So
the whole thing.
so let's go function test.
It doesn't close.
Going about right there.
Yeah.
Okay, and then opening all the way is okay.
Well, for 3 months until I had my surgery, I got out on Thanksgiving, so
Okay,
it's taken that long to do that.
be able to do that. Okay.
Yeah.
Okay.
And I couldn't lift my arm like this. I couldn't even brush my teeth, comb my hair. Nothing. Gone.
So we'll zip around the whole forearm.
Yeah, I'm used to pain in the arm, so.
Well, they look good.
All the way up to the armpit and down the back and.
Yeah, I have heard it doesn't feel anything like a tattoo. So
Yeah, well.
you're
Well,
unprepared.
we're gonna find out
Yeah.
about the nerves real quick, aren't we? Yeah. And no, we don't tattoo for the pain.
All right, so we'll just run it around and see if we can find any hot spots.
See, I thought it was my back where I had surgery that caused the whole thing, and then they found out my neck was broke and slid into my spinal cord.
And so it was compressed. and
Yeah,
everything.
because I had no pain. There was no pain.
So other than the tapping, what are we feeling here?
No pain.
So would you need to go to his neck to treat?
So that's
pain?
something we could.
Oh, you would just want to see her hit that plate in my neck, don't you? Amazing the friendships you make in the doctor's office. I always thought it was ladies first.
Pretty smart cookie sitting over here, huh?
Okay, so we're not getting anything, so let's go. We'll go up 2. Now, I haven't treated a lot of neuropathy, but on the neuropathy cases, it's less about the pain because
Yeah.
they're decreased sensation.
Yeah.
So, on my neuropathy case that I worked on, we just kind of did a set number of pulses, and we just did the entire foot.
Yeah.
And what was cool, I wasn't able to do as much as I wanted.
I can feel that in my elbow.
You can feel that going all the way up.
Woo! It's like hitting a funny bone.
Yeah.
And we're shooting right between your radius and ulna here, so we're hitting all
That's
the
all the way on
nerves.
the back side of my arm. I can feel all that. Yeah, you're opening something up.
I can see your fingers starting to twitch.
Oh, are they? Yeah, it does that from the nerve damage. It freaks out on its own. I can see the muscles going.
There we
Wow, look at that. You're hitting something now, man. That's crazy. On this side, everything's just pulsating like a giant heartbeat. Woo! We got that part. Damn.
So you're putting that like at a number 4 out of 10?
No, it was just like hitting your elbow and your funny bone, and it was gone. I don't know, somebody said it was like you feel it after it's already hit you.
Yeah.
It's gone before you even. That is weird, I can feel it in my forearm, in the bone.
And the cool thing about this too is we got high enough that we're most likely treating the back of your arm too. So
Yeah.
even though we're coming at it from the front,
Like, yeah, so
We're getting all the way through. So when I do knees, very rarely do I have to go around the back of the knee. Just from the front, right there.
There's a
Good one.
Holy crap! Yeah, you're like.
Oh, you're starting to grip a little bit there.
Oh, I'm not doing anything. That's you, dude. You got a ball peen hammer on my funny bone right there.
Okay.
Good God. All right, let's open her up and see me smile.
Okay. What I'm gonna do too is we're gonna make it faster, and then we're just
See,
gonna.
we get.
Yep, we're just gonna do that. We're gonna zip it all the way up and down.
Well, with my hand gun.
Sometimes if the jump in energy is too much, like almost like I was about to do this with you, Jim, where at one level you're like it's not strong enough, and then the other level it was like too strong. Messing around with frequency can sometimes help us find that magic number. So and frequency is something I've been messing around with, and just with patients who've been doing it for a while, and asking them what's better. Some prefer the slower rate, others prefer the faster rate.
Do you do it in the hand too?
I can do it in the hand, yeah. Let's do it.
Oh, it was just a question, really it was. Oh, here we go. Yeah, this might open me up a little right here.
With the hand, we'll turn it down because it's
Oh, come on, surprise the people.
mostly bones.
Don't feel it at all.
And I've been treating.
Oh, I felt that right there. Holy crap.
When I was doing one of the first wrists that I was doing the whole wrist, turning it over and over and over, my hand started getting full of ultrasound gel, and then it was hurting my fingertips and going all the way through from, I was like, oh my, what's going on? First I thought I was getting shocked. I was like, is there a short? Is there, but.
That's kind of what it feels like, kind of like a shot. See, it's like, it feels like my hand's like 3 times the size, and it's just so lethargic.
Clumsy.
Oh, yeah. And as you've seen, it just freaks out and starts.
Alright, let's clean it off here. Look at that.
It closed. Wow.
All the way.
My hand just closed.
Wow.
What the hell? I'm not a plant neither. We're still questioning you, by the way. Oh my God.
Here, just hold my hand, squeeze it. That's pretty good.
Yeah, I can squeeze it. The hard part is opening it. See?
And I bet if we worked more
Yeah, but
on the back.
I haven't made a fist in 5 months.
Wow.
That's the first time my fingertips have touched my palm.
That's pretty cool.
Careful, man. I might give you a big old huggy. That's crazy. Oh yeah, we're gonna see each other again.
Okay.
All right. Good Lord. That's crazy.
All right.
Yeah, we know you're not a plant.
All right. Well, that's it, I guess. Thanks for coming out.
Thank you.
Thank you.
Thank you.
Yeah.
We'll, look forward to hopefully seeing you guys.